Senate Finance Committee Chairman Max Baucus said the cost of health care options being weighed by his panel can be cut to his goal of $1 trillion. That would potentially remove a major stumbling block to the legislation's passage. But in cutting these costs, does the government miss out on true health care reform? Uwe Reinhardt is an economics professor at Princeton University and a prominent health care expert. He's served on a number of government committees and commissions, and he's a member of the National Leadership Coalition on Health Care. He joins us now from Washington. Professor, welcome. Thank you for joining us. Let's try to answer that question. Max Baucus is saying it can be done for $1 trillion, but what is the cost in terms of lost opportunity for health care reform?
Well, for only $1 trillion, he's not going to get universal coverage, but you could certainly cover half or possibly 60% of the now roughly 50 million uninsured. And if you started at the bottom, the poorest, and worked your way up, you could certainly get rid of a lot of distress in American households, but it isn't the whole hog.
Professor Reinhardt, I really want to get down to one of your central points. Everybody is talking about the cost of this plan. That's why we just referenced the $1 trillion. But as I gather, your position is that while it may cost money, it's actually going to do us good in terms of economic growth in the long run. Please explain.
Well, actually, the healthcare is, of course, part of GDP. So if you're spending more on healthcare, more GDP will grow if you have large unemployment and you create jobs and don't take them away from somewhere else. But at worst, healthcare, this added trillion, or it should have been really a 1.6 trillion, will just displace other spending, other consumption spending, and to give particularly younger people, make sure they're healthy, keep them productive. Imagine if you treated depression that is not now treated, how much more productive that would make people. So it's not at all clear that health spending couldn't actually increase the growth of GDP.
Professor, you just mentioned that $1.6 trillion figure. I've seen some estimates as high as $2.5 trillion over the next decade. Are those estimates too high?
Well, 2.5 would be too high. I think most of us who try to make these estimates come out somewhere between 1.6 to 1.8 trillion, and that is driven by how fast health spending in general will rise. Over the last decade, it rose between 6 to 7% per year. Well, if it rises at that rate, you might be looking at 1.7 trillion. But if you assume somehow we will manage to control the growth to only 5% per year, then 1.6 would literally get you universal coverage. And you don't have to subsidize everybody, but certainly, say, up to 75,000 families with 75,000 could get some subsidies toward health care. So 1.6, if Senator Baucus had that, he could pretty much get universal coverage.
Professor Reinhardt, so much of the healthcare debate is intensely political. You're a specialist in economics. Explain to us where we need to focus our attention as far as the economics of this issue are concerned.
Well, the economics, of course, has to do is how is this thing financed? I said if you add another 1.6 trillion to health spending, it has to displace some other consumer spending. That other spending could be other wasteful health spending. For example, we spend far too much on administering private health insurance. The McKinsey Corporation has made that very clear in its analysis. That could be harvested if the insurers ever had a common claims form and common nomenclature, for example. And there are many tests and images, MRI scans given that perhaps shouldn't be given. So we could actually internally finance it if the lobbyists for waste, fraud, and abuse were not so strong. The alternative might be, for example, small sales tax instead of an income tax. I haven't calculated what that would be, but consumption spending in America is huge, must be $8 to $10 trillion, and even a small sales tax designated to be a health tax could finance healthcare without damaging the economy very much. So I think this could all be done. Now, if you Supposing you were crazy enough to recover it all with corporate taxes, that would really damage the economy, of course. In my view, the corporate tax should be abolished, period. I wish President Bush had done it in 2001.
Quickly, Professor Reinhardt, is the lack of attention to waste the single biggest lost opportunity here with about 15 seconds, sorry?
Well, the attention is there, but K Street's lobbyists are very, very strong, and I don't think one president, even the currently popular one, has the power to defeat K Street. I've always joked and said we need General Petraeus to do that. They're like insurgents. And there's a huge constituency in America for fraud, waste, and abuse.
All right, Professor Reinhardt, thank you so much. Uwe Reinhardt, economics, healthcare professor at Princeton.